Welcome to EASD Live. We bring you the gems from the programme, and we've got a great gem. So, Sofia Carlsson, you've produced a very interesting poster on occupation and diabetes, which is also published in Diabetologia. So just tell me a bit about your findings.
So what we did is that we looked at the risk of developing type 2 diabetes across all occupations in the entire Swedish population. And what we see is that in some occupations, there is a threefold increased risk of developing type 2 diabetes compared to others. So that would be cleaners, professional drivers, and manufacturing workers.
So professional drivers, that shouldn't be a surprise.
No, I do agree. It shouldn't be a surprise. But really, no one has looked at it before. So it's at least new, and it's important to show it and not just guess that that is the case.
So what are the factors that play into this really quite marked difference in occupational risk?
Well, the thing is that this is a registry-based study, so limited information on risk factors for diabetes. We did have some information. So for the men, we had information from the military conscription, which is something that all men in Sweden did when they were 18. So what we see is that the future professional drivers, they are almost 3 times as likely to be overweight already at the age of 18 compared to the people who's going to be the future university teachers. So the risk factors are present already at a very young age, and they are also less physically fit. Which is,
and does not the Swedish Army make them fit?
Well, they didn't test them after 1 year of military training, so.
That's really interesting, so that you've got that difference even before their jobs.
Yeah, we also see in the women, because we had information from the medical birth registry, so at the time of the first pregnancy, first trimester. So they are more obese, and they also smoke. So, for example, the manufacturing working ladies, they are 5 times as likely to smoke as the physiotherapists' mothers. So there are major differences in risk factors.
What does this mean then for, let's think about public health first. What are the messages that public health needs to take from this?
Well, I mean, first of all, type 2 diabetes is to a large extent preventable. And you need to reduce your weight a little bit if you're overweight, and you need to exercise more. And I think what we think is that by showing these figures, we can encourage employers to maybe launch diabetes prevention programs at the workplace, and also to make people who work in certain occupations aware of their high risk. And the main public health message, I think, is if you have family history of diabetes, you should watch your weight and try to be a little bit more physically active. And research that has been presented here at the EASD also shows that it doesn't take so much. Just be a little bit more active. Think a little bit more about what you eat.
And what's interesting is that there are quite a lot of workplace schemes to try and get people fitter, but they often tend to be in those jobs that actually your study has shown are not most at risk. So your study really provides a really focused, targeted approach to this kind of prevention work.
Yeah, because you shouldn't be targeting university teachers. That's not the people who need more physical activity hours at work. I mean, so the real challenge is for employers who in the fields of manufacturing workers or cleaners. How are they going to increase the physical activity and make room for that in the workplace? Is it possible, or, yeah?
Now, a lot of cleaners would say to you, hang on, Sofia, I'm a cleaner, I do a lot of physical activity.
Yeah, but then it's the weight that needs to be targeted. A healthier diet. Try to reduce the fat, increase the vegetables and fruit.
And often these people are on low wages, and they find it difficult to get healthy food, and quite often they're doing several jobs.
Actually, that's not the case so much in Sweden. The minimum wage isn't that bad in Sweden. So, I mean, it would be interesting to see how it would look in other countries where maybe the work conditions are worse than in Sweden. But I do agree. And I think one thing I didn't mention is, of course, that in some occupations, factors related to the work itself makes it hard to find time also to be active. If you,
So like lorry driving, of course, you're just sitting all day.
And also if you have very irregular hours, I mean, maybe you just sort of sleep and eat when you're off. I don't know. So, but that's something we need to look into more.
Finally, what about clinicians? What should they take from your study?
I mean, isn't it the same as always that people with family history who are obese should be given lifestyle advice? But the thing is, isn't that so? Reduce the weight, increase physical activity.
It's a message we often give to people, and they don't often take.
But now this is the time when something's going to happen. Workplace intervention is the thing.
Let's be optimistic. Workplace intervention, you heard it here. That's where we're going. There's lots more on EASD Live, and thank you very much, Sofia.